Hello, everybody. I hope that today is a good day for everyone. Here in Barcelona, it's sunny, but today is a great day because of the announcement. I'm sure that out there, some of you at least, saw the last announcement about the European sandbox. So Britain is definitely in, and this is great news for the market, for the trust that this will lead in general to institutional players as well. That is the target that we will start to attack in the second half of this year, more seriously. But yeah, so just to give you another information, there will be another AMA soon. We don't have the date yet, but it will be fully about the European sandbox, so we can communicate to you what are the benefits of being there, how is the dynamic, what we will test there, and with who, and what kind of partner will bring with us. Because you already read it probably in the news, but we're gonna bring with us Coinbase with the base technology. So it's gonna be really interesting for many points of view. Anyway, let's go to the topic of today. And today we talk about a great project. It's a local one, Spanish one, and it's about biotech. So let me invite our guest, Manuel Castellón, and he will tell us more about it.
Hello,
Hello, Manuel.
hello. Congratulations for the prize. And well, I am here to explain our project. In first of all, I apologize for my English because it's no good. But anyway, I will try to present and to understand our project. Okay, Ludo, thank you.
No, you're welcome, Manuel. And doesn't matter for your English. I mean, we're gonna communicate together, so
Okay,
there is no problem out there.
great, great.
Okay. So first of all, let's start from who are you, Manuel, and your amazing background, because I think it's something that is really valuable to know here in the community, and also what is CRB. I think.
Okay. Well, first, the principal thing is I don't know how I do here because in my other life I was a lawyer and an economist, and now I am CEO of Biocross and biotech company. So it's very strange even for me. But anyway, many years ago, maybe 10 years ago, I was the founder of a Spanish venture capital firm as a lawyer or and also as an economist. But now, for different circumstances, I am CEO of one of the companies managed by this Spanish venture capital firm, is Biocross. But this is the reason. So we are the one of the first Spanish venture capital fund for seed capital, and the origin of Biocross was one of our first investment 10 years ago, 10, 12 years ago.
Oh, interesting, interesting. And yeah, let's go more in detail because today we are here for another round of Biocross. I think there are interesting aspects about it. And one of that is, I mean, just to brief a little bit more, Biocross, as you will said, it's already been invested from CRB, that is one of the major investment firms here in Spain and specialized on biotech, right? So what is CRB Token Health? Because you are raising through a token, right? So what is the CRB Token Health? That is how the token is called, by the way.
Okay. CRB Token Health is a Spanish company which offer the opportunity to invest in health based on blockchain technology. And CRB Token Health will invest in Biocross, also a Spanish company managed by a Spanish venture capital firm, CRB Health Tech. So this is the reason in the connection between CRB Token Health, Biocross, and also CRB, the venture capital firm.
Yeah, exactly. And about this, how are CRB token health, because it's the token from the firm apparently, uh, that related with Biocross. How are they related?
Well, when you invest or some investor invest in CRB Token Health, the company will in turn invest in Biocross, or in other words, CRB Token Health is one of the Biocross's investor.
Okay, now it's pretty clear, I think. By the way, if you audience out there have any questions, you can always comment. We will pick up the questions later, and we will talk about that. And Manuel and I, we can always answer to those. Okay. Um, Again, another question. So, what are the advantages of investing in Biocross CRB Token Health?
Well, this is a very good question. In my opinion, there are two important reasons to invest buy a token in health. Firstly, because it provides the small investor with the opportunity to invest in health. Otherwise, it will be very difficult because the health projects are very expensive and until now are reserved for the family office or maybe big companies, biotech companies, or companies, the finance company. Secondly, because the modality of purchasing tokens allows people to invest a small amount, receive high returns, and more opportunity, or more importantly of this is because facilitates the liquidity of the investment made.
Yeah, absolutely. Yeah, that's why blockchain. It's a great revolution here. I mean,
Yes, yes,
it's finally opening the gate and lowering the frictions in the market in order to open to all of us an opportunity of investment in any different locations in the world with a really small amount of money. So finally, it's as we always say, it's the democratization of the access to the capital markets and any other
absolutely,
investment
absolutely.
opportunity.
Otherwise, this kind of investment are forbidden for people, especially for the small investors.
Exactly, exactly. There are still regulations here, regulations, but yes, of course, this is a tool that open up literally the doors to many, many opportunities. This is just one of those. And tell us more, Manuel, what Biocross does. I mean, how do they, how can I say, contribute to the health field?
Okay, because the test developed by Biocross allows for the simple, efficient, and economical identification and quantification in plasma of APOE4. This APOE4 is a biomarker implicated in highly prevalent disease such as Alzheimer and other dementias, cardiovascular diseases, and type 2 diabetes. Through the early diagnosis, excuse me, of these pathologies, not only does Biocross contribute to the health sector, but also to the society. It's very important to an early diagnostic to prevent and to manage the diseases, these kind of diseases.
Yeah, great. Yeah, in a nutshell, basically, just to translate it, because I already know what is it, and that was a kind of little bit technical. So basically, they are biomarkers that in the blood, and am I right saying that between 30 years old and 40, you can perform these exams? Right.
Okay, an example to simplify to understand this question. In other blood or plasma analyze, we have it's very common to look for the cholesterol or triglycerides or maybe PSA for man to determine the risk to prostate cancer or to determine the risk for cardiovascular problems. So, well, this biomarker is another biomarker like this. So, it's very important for this disease to diagnose to the early diagnosis of this disease.
Exactly. No, and you specifically you use it for the Alzheimer. That basically also I'm emotionally involved because I had my grandpa having Alzheimer. So it's something that I really believe that if we really can have it and the diagnostic before we can prevent working on it, so delaying a lot the effects. So I think it can improve a lot the quality of life of everyone
Yeah.
out there, out
Okay,
here.
and one question more important. Until now, there isn't drugs to manage the Alzheimer, but in April of the last year, the FDA approved a drug for the Alzheimer called Leqembi, and especially this week, the FDA approved another pharmaco by Lilly, the name they call donanemab. So now we have two drugs to try to manage this Alzheimer disease. But until now, there isn't any solution. But now it's possible to start to manage these diseases.
Yeah, and one question that I did before, Manuel, in which range of age we can take starting to take this
Well,
test in order to get
uh,
this diagnosis?
well, the Alzheimer, for example, start without symptoms with 40 years old. Okay, but the first symptoms appears maybe 20, 25 years later, for in 65 years. So it's very important to know with 45, know what is your future in this disease. Uh, so this is the question. You are 20, 25 years without symptoms, but we have Alzheimer.
Yeah, right, right. Yeah, this is the question. So when we are around 40 or 45 years old, we should start to take this test, and Biocross could help us
Okay.
to diagnostic this and knowing before that we already can be subject by Alzheimer and then prevent this disease.
Yes, with a health aptitude, it depends on your kind of life. So you can prevent or manage the Alzheimer if you know the situation before the first symptoms appears.
Yeah, yeah, yeah. No, that's great. That's why I think that Biocross really is leading the way in this biotech industry on this specific matter. By the way, just continuing with the questions, how does Biocross benefits from investment through CRB token?
Well, investment through CRB Token Health provide Biocross with the funds necessary to raise awareness in society of the benefit of the early diagnosis of highly prevalent pathologies such as those mentioned earlier, cardiovascular, Alzheimer, diabetes.
Yeah, no, no, that's true. I mean, they need. I mean, that a little bit of more gasoline, to get to the end and to the market. But this is something that I will ask later as well. And I mean, now we just said how the company Biocross is benefiting from CRB token health investment. But on the other hand, how investors can benefit from the investment in Biocross and CRB token health?
Well, by positioning the use of the tested developed by Biocross at the far front, this company values will increase, and as a result, so too will the value of CRB token will be increased also.
Yeah.
Because if you remember, CRB Token Health is an investor, is a Biocross's investor. So if Biocrosses go ahead, also CRB Token Health will be the same way.
Absolutely, exactly. Because one of the questions from the public, I'm gonna pick it from the chat, okay, is why we should use you instead of going directly to Biocross.
Well,
And
I think the explanation or the reason is because the facility to make a small investment and also to the liquidity of the investment made.
exactly. Awesome answer. So basically, whenever you want to invest in a startup, is first of all, I mean, there are always a costs in expenses, in time, whatever. So even Biocross, like if it would be Bricken or other companies, I mean, we don't want to spend a lot of time for small amount of tickets. That's why we
Okay,
automatize
okay,
everything on that. Now, this was the answer to the audience.
Yeah,
Okay.
and for example, the minimum, excuse me, Ludovico, and for example,
Uh,
the minimum ticket for investing in Biocross is more than 50,000 euros. So it's very difficult for the democratic or for the small investors. So it's very important to this blockchain technology in order to facilitate the investing health to the small investor.
yeah. Another question: how is investment risk managed by CRB Token Health?
Well, all investment have a certain level of risk. It's obvious. But CRB Token Health focuses on digital health project in quasi-commercial, late seed or Series A stages with significant clinical and regulatory validation. This approach reduces the risks related to this sector. So we are at the end. The invest no, is not in a scientific project. It's in tests that are in the market now.
Yeah. No, and if I can add something here, I mean, as for you investors out there, the thing is that we have a startup that is not at the beginning, the first phase. No,
Okay.
they are in the market since a lot, right? So in this case, Biocross, I mean, always have a certain history. That's why we will comment about the stage that they are with the product creation and validation till now. But here, when you invest in Biocross, you're investing where already a specialized fund, I mean, one of the major biotech investment firm here in
Yeah.
Spain is already invested
Yeah.
years ago, taking a higher risk. And today, this
Okay.
risk is really lower, right,
Okay.
compared
Eh,
to the beginning. Now, Manuel, it's
Yeah.
not the
Yeah.
question.
In the
Yeah.
beginning, 10 years ago, the risk was very high, but not now.
Ex-
The technological risk. I mean.
Exactly. I mean, the CRB investment firm, that the risk that they took 10 years ago was way higher than the risk that investors are taking today, and you are investing as another really accredited and really specialized firm is or investing. So I mean,
Okay.
you should
Yeah.
understand the value out here and the opportunity, because before it wasn't impossible to participate to this, and today it is, also thanks to blockchain technology, of course. So let's continue. What is the value? I mean, you already mentioned it, but what is the cost nowadays to buy one token, one
Well,
CRB token?
in the same way to the facility to the small investor the opportunity to invest in health, each CRB token has value of 500 euros.
Okay, okay. 500 euros. I mean, in biotech, you know, already know, you audience, that there is a lot of capital spent, you know, to test and to develop products that maybe will be approved from the FDA. Okay, so it's a huge amount of capital usually, but in this case, Biocross is not using this a lot and huge amount of capital, and 500 investment is really low in order to invest in a company that can hit the market with a really innovative product.
Okay, good. Great explanation. Okay, Ludovico,
Thank
yeah.
you, Manuel. I'm trying to to play the ball to make it clear. Okay, two more questions because we had a list about them. In which TRL phase are Biocross products currently? And
Well,
wait,
well,
wait. Let's explain what is a TRL. Okay,
yeah.
so when there is a developer of a product, there are different phases
Hmm.
that mark the stage of the product, right?
Okay,
From the beginning, that is just the idea,
okay,
from the TRL 8, that is the go to market, ready for the
okay.
market, right?
Absolutely,
So,
absolutely.
no, I was explaining to the public, but then you can add something, Manuel, because you know way more than me, no? So,
Hmm.
in which stage now we are finding Biocross today?
Okay, but the Biocross products are currently in TRL7 and TRL8 stage, which means that the products are on the market or very close to being commercialized. So the proof of concept was passed years ago, and now we are in the market.
Yeah, exactly. Exactly. 10 years ago was an idea, and today they passed eight
Okay.
different phases, and they are in the last one, ready to go to market. And that's also
Okay.
why they are looking for money and they want to expand. So, what are the advantages? Sorry, of investing in this kind of project? So developed, almost at the end.
Yeah. So obviously investing in products at the TRL7 or TRL8 stage reduce the investment risk, obviously provide higher potential returns, and has positive effect on society. So well, this is a some important reason because when we started with Biocross, it was 10 years ago, and more or less 7 million euros ago. So the situation now is very different because the product are at the end of his path, at the end of his way to the markets. I mean,
Yeah, no, definitely. Which is okay. So yeah, no, the product is ready, and actually, as soon as you are in the market, I will be one of the first one testing it, and my family as well, because I really feeling emotionally attached to this solution, and I really want to see more products like that, even for other diseases, no, as you were mentioning. So, guys, today was a quick session. Let's wrapping up a little bit. Then Manuel can say something to closing. But first of all, today we are here with Manuel Castellon, real expert in the market, biotech, lawyer, but also economist. Founded CRB investment firm, one of the major medtech investment funds here in Spain. They are based in Madrid. They invested 10 years ago in a company called Biocross. Biocross is with a really easy device that it's almost developed and ready to market. They diagnostic and can diagnostic between the 40 and 45 years old, potentially the Alzheimer disease in the person, in the people, right? So this is a great innovation to understand and prevent this kind of disease that, believe me, is something really heavy for families. It's really heavy for the same person because you're losing the control, etc. We all know how it works. So if we can prevent it and organize and cure it before, we can improve our life and the last years of our life. So I think this is great. So if you want to invest in this company, the minimum investment is 500 bucks. You can invest it, check directly all the information on biocross.s, but also you can check it on the token store that they already created on the page CRB Token Health, right? We will share also this information so you can all have access and read the reasons why it's convenient to invest, what will be the roadmap, how they will spend the money, and also see what is the team behind, and read all the white paper with all the information where you for sure you will find interesting topics and information about it.
okay,
Manuel,
okay.
do you want to say something to close
Yes.
it?
No, thank you very much. I think this is a real project. We are very hopeful with this possibility to use blockchain technology. I think it's a very good, a really a very good opportunity with a measured risk and with a higher potential of returns. But well, obviously, all investment have a certain level of risk. But I think in this case, this level is not very high, and the opportunity is, in my opinion, is a good opportunity for support the health and to help society and people.
Absolutely. Thank you very much, Manuel. Thank you very much, audience, to be here today again. I remember you that today is a great day for Biocross to be live, but also for Brick and for the European Sandbox. So let's go celebrate. Have a good day, everyone,
Okay.
and bye. See you in the next AMA. Thank
See
you.
you. Good celebration. Bye bye. Thank you.